In January, Trump RX is officially scheduled to launch. It will allow people to bypass insurers and other middlemen and buy discounted drugs directly from manufacturers at up to 80% off list prices. One big difference will come with those popular weight loss drugs like Ozempic or Wegovy and Mounjaro. They now can cost over $1,000 a month, but under Trump RX, cash patients will be able to get them for about $350 a month. Then by mid-2026, Medicare will cover elderly patients on those drugs for weight loss for the first time for even less, a $50 copay. Analysts say the Trump RX drug price cuts are faster and deeper than the much-heralded program President Biden installed that got bipartisan support. It involves some phased-in drug price negotiations under Medicare. If the Trump plan works, it can't come too soon because Lisa Fletcher reports the Biden price negotiations could be backfiring.
Here you go. It's now law.
When Democrats passed President Biden's Inflation Reduction Act in 2022, it came with a high price tag and a big promise.
We're giving Medicare the power to negotiate those prices now on some drugs. This means seniors are going to pay less for the prescription drugs.
The idea that for the first time, the federal government would negotiate drug prices directly with drug companies. The aim? To lower costs for both the taxpayers and Medicare patients. Medicare provides health care for 67 million adults, mostly seniors. The program cost taxpayers $1.12 trillion last year, of which more than $220 billion was spent on prescription drugs. Like $12.6 billion on the blood thinner Eliquis, $4.7 billion for the diabetes drug Trulicity, and $3.2 billion for Imbruvica that treats cancer.
Policymakers really do not understand how the drug markets work. They simply don't. And they're legislating based on these profound misunderstandings of how things work.
Bill Smith is a health policy expert with the Pioneer Institute in Boston, a public policy think tank. He's been tracking drug prices since the law passed and noticed a trend with out-of-pocket costs, the cash that patients pay up front at the pharmacy. His study findings for most of the 10 drugs the government negotiated lower prices for, costs for patients have started to rise significantly, even before the new negotiated prices come into effect.
I think the biggest surprise was that out-of-pocket costs were up 32%. The government should be embarrassed by this.
So why are costs for patients going up instead of down? Middlemen companies called pharmacy benefit managers, or PBMs, usually negotiate drug prices for Medicare patients. But Smith says with the government cutting out the middlemen for lower costs, the middlemen are finding ways to charge more elsewhere to keep the profits rolling in.
So the way to make it up is to charge seniors more out of their pocket. We finally beat the pharma companies, is what President Biden said. Well, the seniors are the ones that got the short end of the stick here, and they were supposed to be the ones that were helped.
Smith showed us what's happening with Eliquis, a popular drug used to treat and prevent blood clots.
You know, this is Eliquis in all 4 PBMs. The average out-of-pocket cost went from $77.99 to $106.10 across all 4 PBMs.
Smith says PBMs are likely padding their balance sheets by raising out-of-pocket charges now, anticipating lower revenue when the drug cost controls start next year. While direct drug price negotiation passed under President Biden, Trump has also made lowering prescription costs a priority.
Here is the bill. Bobby, come on over here.
He signed an executive order to tie the price of drugs in the U.S. to the lowest prices paid in other developed countries. In early August, the president proclaimed incredible savings.
You know, we've cut drug prices by 1,200, 1,300, 1,400, 1,500%.
The White House later clarified Trump was talking about future savings.
Hey, I'm Robert F. Kennedy Jr., your HHS Secretary, and today we met with patients from all over the country.
Health Secretary Robert F. Kennedy Jr., now tasked with making drug makers who are bitterly opposed comply.
We're in negotiations right now with the pharmaceutical companies, and we are going to pay the same at the end of this as people pay in Europe and other nations.
According to Bill Smith, the lesson to take from President Biden's effort to lower drug costs is that it is much harder than it seems.
So what effect has the Biden plan actually had on drug prices?
Well, the government is going to pay less because the list price has dropped. But unfortunately, senior citizens who are on Medicare are going to pay more out of pocket.
2026 will prove whether the efforts of Presidents Biden and Trump can finally start to bring drug prices down. For Full Measure, I'm Lisa Fletcher in Boston.
And a note on a story we've covered a lot over recent years. The CDC has amended language on its website to acknowledge for the first time studies showing links between vaccines and autism. The new statement reads, "The claim vaccines do not cause autism is not an evidence-based claim because studies have not ruled out the possibility that infant vaccines cause autism. Studies supporting a link have been ignored by health authorities." That new posting also adds that the Department of Health and Human Services, under Secretary Robert F. Kennedy Jr., has launched a comprehensive assessment probe on the causes of autism.